Our next speaker is Frankie Burgett. She is a licensed and national board certified occupational therapist at the mastery level and a senior instructor and coordinator with Myofascial Release centers. And she also owns Windsong Therapy and Wellness Center in Bedford, Texas. Please help me welcome Frankie Burgett, who's talking about facial integration and therapy for pain relief.
Hi, and welcome. Can you guys hear me? My throat's been can you hear me? Okay. If you can't kind of wave at me, because I've had this laryngitis over here. Basically, kind of what I want to talk to you about today is fascial integrative therapy, which is what I do, which is pretty much a step above just your traditional myofascial therapy. That's kind of where I started. One of the places where I actually started, I've been doing this work, I've been an occupational therapist for about 25 years, and I've been doing this kind of work. Do you want me to use my?
Oh, yes.
Can I hold it?
You can hold it.
Is that better? Can you hear me now? Yeah. Well, I hate this. I don't do this well. I've been an occupational therapist for about 25 years, and I've been doing the fascial and cranial work for about 15 years, and I've been in private practice for about 10 years. And one of the reasons that I got involved with it was because all the nice traditional things that were out there and all the fun little modalities that we like to play with as therapists weren't working. And I realized there was a piece that we were missing somewhere, and the more I got into doing just your traditional therapies and, like I said, the modalities, I realized that, you know, these are all great tools, but we're missing the essence or the core of what actually causes making our body work. And what is actually caused, it affects every system of the body. So I took actually took a cadaver dissection course at UT Southwestern. And I can remember this is before I actually got involved with the fascial work and the fascial and cranial work, and I thought, I went in our first class, and the doctor walks in, and we're supposed to make our first incision, and I'm cutting, I'm not getting anywhere, and there's this really tough stuff that's in there, and I thought, what is this? And so I asked. And he says, actually what it was fascial tissue, which I didn't really understand. And I said, well, it's just connective tissue, just cut through it so we can get to the good stuff being the muscle. And I thought, okay, well, as I got into this dissection further and further, I realized how involved this was in every aspect of the body. It is all the way, when we got down into the viscera, the internal organs, how this was surrounding and separating all of the internal organs. And I thought, this is kind of some interesting stuff. So as I got in further into my career and realized that, like I said, there's got to be another piece in here that we're missing. And as I started researching a little further and got more involved with the fascial system as a system, what I was taught in school was there's that dumb white stuff that covers the muscle. And you rub it a little harder and everything goes away and everything's fine. Unfortunately, when you really are doing true fascial work and understand it as a complete system that affects every organ, every cell, everything in the body, that you start to realize that maybe this was that missing piece. And I started thinking back on my cadaver class and thinking, well, maybe there was a little bit more to this than just that. So that's how I basically got involved with the fascial system. And the more that I've studied and the more research I've done and the more experience that I have, I realized how involved and how important the fascial system is in every aspect of what we are as far as how our body functions. I treat a variety of different people, from people with neck and back pain to headaches to I work with psychologists dealing with doing body work. Emotional issues, all kinds of just, working very closely with a lot of these doctors. I also work with a lot of kids with ADD and ADHD, digestive problems. I have people that have come in that have supposedly irritable bowel syndrome, and we get into balancing the body. They actually come in with low back pain, and then they'll start telling me how they have irritable bowel syndrome, or they've had this problem, and all these other things that are dealing with either the endocrine system or maybe the digestive system or circulatory problems. And as we start to, through these various techniques, to balance the body, listening to what the body is telling us, because it'll give us the information. Most therapy what most therapists want to do is go in and fix it. Your intent is to go in and fix this. Well, you can't. And we as therapists cannot fix anything. What I look at myself as is more of a facilitator. And what I do is facilitate your body to heal itself by bringing it back into balance. The fascial system is actually not just that dumb white stuff that covers the muscle. It's actually a network or a matrix or a web that runs through our entire body, and it surrounds every cell in our body, all the way down to, like I said, I've got slides that I use sometimes when I do other lecturing. It shows, it was taken with the electron microscope, it shows fascial connections between brain cells. So if you think about it, if there are restrictions in the fascia, which has a tensile strength of 2,000 psi, which is pretty much like a regular tire strength, if you've got restrictions in a tissue that is that strong, it makes sense that it's going to inhibit any kind of blood flow or elimination of toxins or mobility or motility that we need between the viscera. It's going to have an impact and impede the natural functioning of these organs. For example, like people with irritable bowel that come in and they have a secondary diagnosis of irritable bowel. If you think about what that actually is, that most of these people, if you look at what their posture is doing, most of these people are standing like this. So they're actually compressing all of the internal structures. And when you've got the muscle that can't do its job anymore, and the fascia comes in and try to save the body, it's going to protect it and give you support. Well, what it does is it holds you in this position. And I have a lot of, can I use you as an example? Sandy's a friend of mine, I've known her for a long time, and a lot of what she's got going on here is she pulls way forward and to the side. And when I first started seeing Sandy, 5 years, 6 years ago, something like that, her neck didn't even move. She didn't move her neck anywhere. And she had a lot of other things that were going on. There was other things inside that were going on. And so what we did was we worked to free up all of this tissue to open her up so that she not only has the mobility and more range of motion in her neck, but it also freed up all the internal structures so that a lot of the swallowing, I mean, she's having some swallowing problems, TMJ problems, and other stuff where she has like reflux, you know, and if you think about it, if something's being compressed like this, how could it possibly work? It can't do that. And unfortunately, a lot of the nice medications that a lot of physicians like to give us are all fine and dandy, especially like you see a lot of the medications. Think about that. Everybody in here has it with bowel or knows anybody who has that. Think of the medications. People that I see that are given tons of medications for it. But if the fascial system, which again is, fascia is inside of our gut, okay? And if it gets tight and bound down, I almost think of it as like a film. I mean, it isn't a film, but it's so tight that it doesn't allow for the internal organs in our gut to absorb all of the nutrients and stuff that we need from getting proteins and certain, whatever we need from our food. Plus, it doesn't allow us to get the right amount that we need as far as medications. All right? So none of these things are being absorbed correctly. So you're not getting what you need from the food, and it's either passing by through too fast or it's being held in there. That's going to be a little irritating, So when you think about this, and if you're stuck in this position because maybe you have had a forward head or your pelvis is out of alignment, whatever, your body's out of balance, all of these internal organs are being crushed. Okay, they're just being compressed. So there's no way. I'm just using irritable bowel, that as digestive problems as an example. But I see this all the time. And that's one of the most common things that I see people coming to my office with. Back pain, neck pain, that's what they originally present with because it's painful. And then I start noticing all these other things and I'll say, well, we have a problem here. Or they'll start having all kinds of problems with, liver function, things that what the liver should be doing. And they'll say, oh, well, yeah, my doctor has me on this and this and this. Well, think about it. If your liver's sitting here and you're squashing it, let me just back up for just a second. The viscera, or our internal organs, have a motility to them, which is a movement. And it's all part of this rhythm in our body that is a constant ebb and flow in our body. part of the craniosacral system. But if that isn't working right, then the functioning of these different organs, particularly things that are triggered by the endocrine system, are not going to work. Okay? They can't possibly work. If your liver has to work by moving, has to have the freedom to move to allow it to do what it's supposed to do. Same thing with like peristaltic motion in our stomach. All of these different things, our stomach, all of these things have to move in our body. Okay? If they're restricted and they're not moving, then they're not being allowed to do their job. For example, the liver may not be able to eliminate toxins and work on it the way that it's supposed to be doing. The movement of that liver can be restricted from the fascial system. Okay? Every organ in our body is affected by the fascial system because it's all surrounded, it's suspended in this. If that's tight and bound down because of a postural thing or an imbalance in our pelvis someplace else, that's going to inhibit that movement. Another one that I see a lot of is how many times you just look around and how many people do you see that stand like this? Okay? They stand with a forward head, they're crushed down through here, they're usually tight through here, which is what's keeping them. When you do this, you compress up here high in your cervical spine or up here in your neck, which slows down the movement of the cranial bones in your head. Now, a lot of people think that when you're a kid and after you get up to be a teenager, that those bones fuse together. They don't. There is a constant ebb and flow movement of the cranial bones. Okay? This movement or this constant ebb and flow of this is what triggers our endocrine system to work, particularly the pituitary gland. It sits like a little cherry on the string, basically right behind our eye. When you draw a line straight back in the middle of your head, that's what it's a master gland of our body. And there's a bone inside our head, right in here, kind of shaped like a butterfly. It's called the sphenoid. And that movement of that bone is what milks the pituitary gland, stimulates it to do its job, which triggers the rest of the glands in the endocrine system to do its job. When that's not working, that's when you start seeing all these problems with the endocrine system. Now, if you don't change that, then what kind of medications you give, it's not going to do any good. Okay? So when you start thinking about all that stuff, that restriction, the reason that's not moving is because there's restrictions in the fascial system. And it may be just a postural thing. Somebody's standing with a forward head like this because maybe they work at a computer all day long, they've tightened through here, they've compressed this spine, so now maybe they have neck and back pain. But on top of that, it's affecting all these other pieces. So at Windsong, what we do is we look at the whole body. You have to look at all the body structures and see what is actually happening with this whole piece. Why does somebody have a problem swallowing? Well, they have a forward head, it's going to compress some of this stuff in here. Okay? Think about what that's doing to your heart. If you're standing like this, your heart has to work twice as hard. You can't get a good breath, so you're not getting good oxygen into the lungs to get good oxygen uptake in the blood, which means that all of that's not filtering through your body. You're not eliminating toxins. Think about your lymphatic system. Your major area of lymph nodes is right in here. Okay? And groin, of course. But I mean, just talking about your neck. If these are compressed, how can that possibly eliminate the toxins that need to get in there? So we're walking around just toxic. And like I said, I have no problem with surgery and medicine and medications when we need them, but we need to look at all these other pieces and say, wait a minute, what actually could be causing, what can we do naturally? What's actually causing this? Because when you see these people like in this kind of posture, you got to ask yourself, wait a minute, there's a problem. It's interesting because I was just seeing a lady the other day who's been trying to get pregnant. And she was having all these problems, and I kind of talked her off, and finally she decided to come over. I finally saw her the other day, and she called me and she said, I'm coming over. Actually, it started a couple months ago. And I've seen her 3 times. And she told me, she said, called me the other day, and she said, I don't know, but I just want to let you know that I was supposed to start my menstrual cycle a week ago, and I haven't done it yet. And I said, good. Maybe. And so she said to go, I don't know Sheryl when or she's going to. But my thinking is that she probably was able to conceive because the reason she was having so much trouble is that she came in to me like this. And she had this incredible torsion. It's like somebody took her whole pelvis and just twisted it and torqued it. Now, just if you ever get a chance, or if you don't already know, go look at an anatomy book. Look at what sits in your pelvis. This is your entire reproductive organs. Okay? If you're kinking a hose in there somewhere, what do you think is going to happen? Just, I mean, it's mechanics. And the reason that you see a lot of these problems, it goes back to the fascial system. It isn't a muscle. You can have a muscle imbalance, but the fascial system is not muscle. 80% of what we call muscle is fascia, but it goes way beyond that. That's what we're taught. That's what most people treat. That's what most people think of as the fascia. And you'll go around and see people that say, oh yeah, I do myofascial release. Well, what they're doing is they're working on the superficial areas. They don't look at the whole body. And they're not looking at it as an entire system. It's going to affect every other part of the body. And at Windsong, that's kind of what we do. We take it a little bit step further past that and look at the entire, it's not just for just pain relief that can't help, but if you're not balancing the entire body, and like I said, 99% of the people that come in, and they come in with neck or back pain or headaches, but they've got, just give me my signs, I don't run over. There's probably something else that's going on with that at the same time. People with allergies, okay? How many times, I mean, listen to me, right? People with allergies. I have been working with tons of people with allergies, with chronic sinus infections. If you think about it, if all that stuff's just sitting in there, and you're not getting good oxygen or good blood circulation and eliminating that stuff, why do you think, I mean, anything that has a chronic infection on there, you know, we shouldn't be having that. And if we're taking rounds and rounds and rounds of antibiotics and it's not working, it needs to be telling me something. We shouldn't be looking at that. My ADD, ADHD kids, I totally believe in that. But I also believe that probably half or more of them don't really have that. And if you look at these kids, they're being diagnosed with ADD or ADHD when they get into like 4 and 5 or even someone a little bit later. Well, that's at the point in time. Think about it. These kids that I see that are being diagnosed with that, they're coming in, they've got a torsion in the pelvis. I mean, a lot of these kids are complaining of back pain. Is a 6-year-old supposed to complain of back pain? I don't think so. And a lot of them are coming into stuff like that, having headaches. So yes, I do believe that there is ADD and ADHD, and some kids truly have it. And there are all kinds of things that we know traditionally what that is. But a lot of the kids that I see that are being diagnosed with this, if you have back pain or you have something that is making you uncomfortable, are you going to sit still? No. I'm watching people in there right now that are shifting around, just sitting here for the last 20 minutes. Okay? If you're a kid and you start to do this, you don't understand what it is, so you're going to move around. Well, they're getting labeled as this, and a lot of these kids that I'm seeing, putting them on Ritalin, and they're doing all this stuff to them. One, it's not only just that, but the diet. Of course, I think that's obviously a big, that's a big factor in this. But you got to look at what's happening to them. What is their body telling them? And a lot of these kids are coming in with these major restrictions, major torsions, and all this stuff that's going on in their body. They're not balanced. So not only is their endocrine system being all screwed up with all this, but they're in pain. Okay? I'm not going to sit still and do this. Then by the time, and we don't notice these things because about the time they're being diagnosed with this is about the time that they're coming into their bodies a little bit more, they're being asked to do more, they're being asked to sit still, their bodies are starting to come in where they're being challenged to do more things physically, and that's when these things are starting to pop up. It isn't some miracle thing that all of a sudden at 5 or 6 years old they're suddenly getting this disease. They've had it. It's been going on since they were children, little babies, but it's been a progression. Now, because of what we're asking them to do, that's when it's starting to come up. And I see these kids all the time. A few treatments later, boom, they're fixed. I used to see them a couple of times. By the time you get them back in alignment, and I tell the parents, look, let's just watch them. If they take a growth spurt and you notice something, bring them in and we'll fix them. Kids mold easy. You don't mold so easy. But the kids are just like that. And as a matter of fact, I have a friend of mine that's a DO who's starting to work with a lot of autistic kids. And we're starting to do, I was talking to him yesterday, and they're going to start doing some interesting research. And he knows I've worked with a lot of those kids too. And we've done some stuff with ADHD. And so we're going to start doing some work with autistic kids because I think it's the same thing. And it's just like I said, I do believe that, that our food and our intake of food and what we eat and what we take into our bodies is important. But if you're taking all these different things, but your body's not able to absorb them, it's going to eliminate them. So what good are we doing with all the supplements that we're taking in the first place when our bodies can't absorb them to begin with? We need to take a step back further and look at what our body is telling us. And if we're out of balance, then none of this stuff is going to be effective for you if we're out of balance. And we've got to I've studied in China back and forth a couple different times and in Tibet, and this is all goes back to what they've said. How does our body interact with everything that's around us? And our body is affected by everything. So but I believe that going back in the Chinese, like I said, particularly the Tibetans believe that. There's another system in our body that we really need to be looking at. And when you're looking at a tissue as well, that is the best conductor of electrical energy in our body. It's like kink in a wire. If we can't get that electrical energy through our body, which being even and being evenly distributed and balancing through our body, then there's no way that all of these systems are going to work, because all these things have to work together. That's what causes the chemical reactions in our body that allow our bodies to function in a normal process. That's not happening, and I think that the fascia is that forgotten system, because in traditional medicine, we're taught that it's just connective tissue, don't worry about it, it's just that dumb white stuff that covers the muscle. When in all actuality, it does affect every system in our body, to, like I said, the viscera, to everything. So as far as pulling the body back into balance, that's what we need to look at, so that all these other nice modalities and all these other techniques that we're using are effective. I've been lucky enough in my career, I've had the opportunity to learn several different things. And I've noticed the difference in how effective they are in so many different areas now. When my first core basis is looking at the fascial system and bringing the body back into balance, and then being able to integrate all these other pieces as need be. So if you're not getting anything else out of this, just look at that. Just look at people. Look at your own body. Listen to what it's telling you. But if we're not in balance from that standpoint, structural standpoint, then none of these other pieces are going to work. It's like the foundation on a house. If the foundation on a house or building is crooked, nothing else is going to work. It's the same with our bodies. So we've got to take a step back and get back to some of the basics of this and realize how everything in our body is all connected and connected. Okay, I'll be quiet and give you 2 minutes. Okay, 2 minutes for questions. Anybody have any questions?
Yes, my son, he has hypotonia. It's low mass. And he has this feeling of speech like because he doesn't have the muscles to give it straight. And he complains about not being able to chew well, and he chokes. And he complains about being here, kind of like whether it's swimming. So I told him because you need to keep watching that, you need to sit up straight. And so if he has a low muscle mass, how we can keep that muscle?
Low muscle tone, you mean?
Low muscle mass, that's what I would
Tone? Okay. Well, mass and tone are kind of different, okay? So a lot of times what happens is because you're affecting, well, a lot of these kids that I do see kids that are real hypotonic. A lot of these kids have a restriction in what we call the dural tube. And the dural tube is it's actually the fascial coupling around the brain and spinal cord. And that's your central nervous system, okay? And it not only affects, again, the endocrine system, which is going to affect muscle development. Could have been something that was born with, could have been a restriction in utero that caused it. But a lot of these kids, the majority of the kids that I see that are hypotonic like that, they have this position, and what that's doing is that's not only not allowing for the craniosacral system, for the craniosacral rhythm to work, which is what produces all of allows our body to work, but there's a fascial restriction in that that's creating that and not allowing that to happen. So that it's affecting the neural system, which is going to affect muscle tone and the input that you're getting to the muscles. And at the same time, he can't sit up because he's kind of in this vicious circle. He can't sit up because he's stuck down like this. A lot of the pains and stuff that he's getting are because he can't sit up. So he's basically fighting against himself to try to sit up, and he doesn't, because he is hypotonic, he's probably restricted in the range, And then because of that, he's fighting against a really strong tissue to sit up, and he doesn't have the muscle strength, and he doesn't have muscle strength because he can't get there in the first place. So what I do with these kids is bring them back into balance, release this area, bring them back, release the dural tube so that they can, you know, that their neuromuscular system, or the nerve system can work appropriately. And then these kids start to be able to use the muscle tissue, use the muscle strength that they have, and then they begin to get stronger. It isn't a big exercise program, it's just bringing them into balance, taking the restrictions off their body and allowing them to grow and develop like they should do.
So, there's hope?
Oh yeah, absolutely, we see it all the time. If you want me to talk to you about it further, there y'all let me tell me to go, but I'd be more than happy to talk to you further about it. Anything else? Anyone else? Okay, my thing is right back there at Windsong, if anybody has any questions, just come on by. Thank you.